Good morning, and welcome to this critical conversation around how we're feeding the nation during COVID-19. This is part of the Milken Institute's conference call series. Over the past few weeks, it has hosted conversations covering vaccine development, strategic philanthropy, and the market implications of this coronavirus. And like those calls, this one will be recorded. And we have many participants on the phone. And although we can't see all of those participants, we can only see our speakers. There is an opportunity for everybody to participate. And on the bottom right hand of the screen, anybody can submit questions throughout this conversation. And I'm going to do my best when we get to our Q&A portion of the discussion to get through as many of those questions as we can. So I just want to start by saying, Claire and Jose and Mike, it is so good to see your faces. I just can't wait until I can hug you when I see you again in person. And I want to thank you for making the time, particularly you three, given all that you're doing for the nation right now. We all know, everybody on this call and everybody in the world is well aware that we're in the midst of an unprecedented health crisis, with every nation trying mightily to prevent and control and cure this virus. But we're also in the midst of another health crisis, and one that's getting a lot less attention, and that's food insecurity. I have been extremely disturbed by making to increase daily around the numbers of our neighbors and fellow citizens who are joining the ranks of the food insecure. Not since the Great Depression, I think, have we had so many Americans facing the prospect of not being able to afford or find food. At the same time, we know that our donations to food banks are down significantly. We have children across the country out of school, and for millions of children, school is where they're getting most, if not all, of their meals. And then, like many of us, I've been seeing these disturbing images coming from farms and dairies of produce fields being plowed over or dairy tankers full of milk being dumped. And I think we're all asking ourselves these questions of, what the heck is going on? How do we fix it? And how can I help? And so I'm really glad the three of you are here today, because I'm hopeful that we'll get some answers to those questions and come up with some new solutions and perhaps sprinkle in a little bit of optimism. So I think you're all three muted, so I need you to unmute yourselves. But I'm going to turn to you, Claire, first to kick us off.
Well, thank you, Ryan. And first, let me give thanks all around for the fact that you would invite Feed America to this conversation, that you'd allow me personally, once again, to be in the company of friends like Jose and Mike and you and the Institute as we work through how to address some of these really challenging issues that we're all confronting together. So to set the stage for the order of magnitude of the problem, I think maybe I'll do it through the lens of what we're experiencing as a food banking network. And I'll give a little context for who we are first, if you don't mind, and then talk about how things were before COVID-19 and what we're seeing right now.
Great.
Feeding America is part of a network of 200 food banks around the United States and 60,000 plus pantries, soup kitchens, meal programs, and in normal times, 2 million volunteers. Through our network, we distribute over 4 billion meals a year, and before COVID-19, we were doing that for about 40 million people. Food insecurity rates in the country before COVID-19 had finally, after 10 years, returned to pre-recession numbers. Of course, 37 million people in this country not having consistent access to nutritious food is 37 million too many. But our data shows, and we've been performing impact analysis inside of Feeding America, and it shows our estimates are, we believe conservatively, that there are going to be an additional 17 million people who are food insecure as a result of COVID-19 and the impact that it's having on the economy. That's being realized at food banks and images that I'm sure so many members of this audience have already seen images of 10,000 families showing up at one distribution in search of food. As an example, out of our San Antonio food bank there, under the great leadership of Eric Cooper, and we have an image that might be helpful right now for people to see if they haven't seen that image before, of those cars all lined up, ready, waiting, and hopeful to get additional food. As a network, 97% of our food banks have seen significant increases in demand. Overall, on average, that's a 70% increase in demand. And we have food banks who've seen as much as 200% increase in demand. While we've seen some contraction in our primary source of food, which is through donations. So in normal times, of that 4 billion or so meals that we provide, 1.4 billion of them are the result of donations that we've received from retail grocers, for instance. We've seen contraction in those donations, as much as 60% contractions. And that means then that we have to pivot and go out and try to purchase food. Even purchasing food in this environment can be challenging, especially because the food that we're better able to distribute at the levels that we need to would be shelf-stable foods, and shelf-stable foods are in high demand right now. So we're showing images of those piece cars line up, and now images of those 10,000 families who came to that one food bank hoping to get additional food to feed themselves and their children. And that's the challenge that we confront today. So I'm excited that you would provide us with an opportunity to talk about the challenges. But as you already said, Ryan, maybe we'll have some time to talk about some of the things that are working and why we have hope. But there certainly is still a gap. And hopefully some of the people who are participating in the audience can help fill some of those gaps.
Great. Thanks, Claire. And Jose, you and your team at World Central Kitchen have flown into action after storms and earthquakes and fires and floods around the world. I think most notably your work in Puerto Rico, serving something around 3.7 million meals on that island. What is World Central Kitchen doing now? How is this different? How is it different responding to a public health pandemic versus a natural disaster?
So we saw this coming from the moment that we had to send a team to Japan to help the Japanese government and the cruise ship to feed the 6,000 people inside that boat. Many of them American, many nationalities. And that gave us a very good insight about not only that we were under an emergency, but this was not normal times, and the same protocols didn't apply for feeding people. This followed with California, where Governor Newsom called us, and we were right there. Even before he called us, we had already a team. And that means at World Central Kitchen already we had our hat of knowing this will reach America, and if it reach America, what we will do. We were watching very closely, very early on in January, because it's something I love to do, what was happening in Wuhan. Happens that one of my best friends was the Mexican ambassador in China for many years, and he follows what happens in China very closely. So for me as a chef, I'm always fascinated to see how people are fed in those moments. So we began gathering all the information, trying to understand what was going on. So very, very much early on, we began putting like health protocols. What restaurants will have to do of food people to keep feeding the community, but doing it in a way that you protect the cooks, you protect the people doing it, the people distributing the food, and the people receiving the food. So that's what we've been doing. Obviously, Washington, D.C. is what World Central Kitchen is located. We began doing what we always do. We do a map, and we began watching what cities were becoming hot zones. And we began deploying teams to try to do what we do best, which is we know these great organizations like Feeding America, all the food banks and their partners, that they cover an amazing quantity of places. but we are specializing covering the blind spots, the darkest spots that sometimes the system is not able to cover for different reasons. So that's what we began doing. So in LA County at the school system, we are already helping provide of the close to 1 million meals they do a day. We are providing 40, 50, 60,000 already this week a day. We are helping in Washington, D.C., feeding many of the police officers who are sick at home. It's a lot of police that seems they need help, and we've been helping them and some firefighters. We have this system where we are in hundreds of hospitals, not use the food to send a good message to the doctors and nurses fighting this battle, but in the hospitals that for different reasons the feeding system has shut down. We are there making sure that we are able to cover those needs. We are right here, not too far away from my home, at the NIH Children's Hospital. So in short, the men and women of World Central Kitchen, we are already in more than 90 cities. We have more than 500 restaurants that we brought into our system, partnering with us. We have food trucks like in Little Rock, Arkansas. We have arenas like the one at the National Stadium here in Washington, D.C. We always put arenas up and running in these emergencies. This is not being any different. We have other arenas coming in other parts of the states. In short, right now, I think we are doing close to 250,000 meals a day. Many of these meals, we pay the restaurants. That's one of our strategies. Why? Because nobody can do it alone. This we know. We need to be supporting the effort of big organizations like Feeding America, who they are always at the front of making sure that hunger is not an issue. And we are here to try just to cover the gaps that the system does. So I believe we need a 360-degree way to do it. Food banks is one way, making sure that we establish other ways to deliver food, like supermarkets. Many restaurants are becoming grocery stores, and they are able to deliver flour and eggs. That's another way. Putting restaurants up to run, that's another way. Putting food trucks up to run that allows you deploy very quickly in overnight places. Every day we are opening 1 or 2 or 3 new cities, and this is why we are able to do it so quickly. We put the restaurants that they are without job up and running again. It's a very simple way to don't throw money at the problem, investing in the solution, putting the restaurants running, paying the salaries, restaurants being able to pay their small farmers, and in the process, between all of us, keep feeding America.
Now, as a humanitarian as a humanitarian and the founder of World Central Kitchen, and we forget that you're a business person and a world-renowned chef, and you have 27 restaurants of your own. So can you speak a little bit more about the impact on the restaurants and how you at World Central Kitchen are sending money through restaurants to get them back in business?
You just want to be clear that of the 27, but it's more like 31 restaurants, 16 are owned by Think Food Group. The others are just partnerships we have with casinos and hotels.
Right.
On the 1,600, I'm very proud that during 5+ weeks, we've been able to pay benefits all the way until the end of April. Since we shut down in March, full benefits to every single employee, front and back. And it's not been easy, but for me, this was very important. And what I did, number one, was the safety of my employees and obviously the safety of the guests coming. When we were one of the first groups, the first in the front lines, shutting down all the restaurants. I even wanted to do it before, but I had a lot of other partners that we had all to do it at once. And let me tell you, the hard reality is this. We can all be home and waiting for this to pass, or we can be like we saw in Wuhan, part of the solution. It's very quickly, I announced that my restaurants were going to become community kitchens. What is a community kitchen? Well, we kind of help establish that a community kitchen will be a restaurant that will be able for takeout or delivery using Uber, Lyft, or other systems, and where all of a sudden this was not normal anymore. This was emergency. The restaurants were there to bring food to the elderly that cannot leave their home because they cannot and they don't have any help, or the nurse coming back late from work and doesn't have enough food to feed their families, etc., etc. So this is what we did. Just put the restaurants up and running. my restaurants in DC alone, they've done 25,000 meals. I want to make sure everybody's clear. I'm the owner of my company. I am the founder of World Central Kitchen. My restaurants in DC, the 25,000 meals we've done so far, we don't get any compensation from World Central Kitchen. I'm a guy that always tries to separate church and state, and I do this very well. I live a good life all my life, and I keep planning to do so. But this gives me very good insights. How we can, I just came back from Corona. I just came back from Harlem, from Brooklyn. For me to partner with a restaurant who is deep in the community, and that restaurant that everybody loves and enjoys in the good times is able to be part of the solution and deliver food to the elderly home nearby, or to the hospital nearby, or to the homeless shelters nearby. This gives me a lot of joy, because we always said that the restaurants are the DNA of a community. Today, more than ever, restaurants are the DNA of the community, keeping everybody fed as we go through this crisis.
Mike, many people may not know that you have not been sleeping. I think you've spoken to more business leaders, government leaders, scientific experts than anybody I know of, trying to figure out how we're going to get through this crisis. And you've got some interesting perspective based on what's been happening internationally. Can you chime in here and share what you're seeing and what you've learned?
First, Ryan, thank you, and it's an honor to be with Claire and Jose again. You know, we've been on many sessions on how we're going to provide healthy, nutritious food to people to energize their immune system, but this is quite different, that the three of us have been convened again during this crisis. And I think when I approach these areas, we try to think of them from a system approach. And we have a lot of knowledge of what occurred in China, since they dealt with it first, that we might be able to apply here. Alibaba delivered 100 million packages a day at the peak to 150 of the largest cities in China. And what did they find? Many of those packages were coming from restaurants. They had more than 2 million people involved in delivery of these packages. As the restaurants shut down, more and more of this food had to come from other sources, and in this case, grocery stores and other elements. And in thinking of a distribution system where you didn't have 2 million people out because you're being sequestered, they used buses that were no longer running. Put the food on buses, distributed to individual points that people can come to. So as we think about the United States, we could step back in time quickly and go back to 1800, where we really had 90-some-odd% of the people worked on farms and producing food, and we just had a little more than one person making food for maybe 1.5 people eating it. By 1900, we only had 40% of the people working in food and agriculture. And today, those growing food and agriculture only make up less than 2% of the population. So we had the ability for one person to feed hundreds or 1,000 people. And so as we think about this system, how do we get food from farms? The idea that we have food insecurity in the United States is something we would not think about in terms of abundance in a country that wasted 50% of all food last year, as we thought about it from an environmental standpoint. So what do we know? We know that this is an unprecedented period of time. Jose, who took the lead in Puerto Rico, the Red Cross estimates that 12.8 million meals were served in Puerto Rico after the hurricane. If you want to go to other hurricanes, last in Louisiana or Texas, about 4.5 million. And if we want to go to the wildfires in California in 2018, about 400,000. Well, to compare that with this crisis, LA Unified is estimating that they will serve 25 million meals by the time school was scheduled to end on June 12th of this year, 25 million. LA Unified, as Jose and Claire have kind of referred served 1 million meals a day to students, 700,000 students, and breakfast, lunch, and in some cases, dinner to go home. But this is a large capability of producing food, and by last Friday, April 19th, LA Unified had ramped up with the help of food kitchens and Jose's efforts and what Claire's organized to serve almost 600,000 meals in a day. And we think about it, on Friday, just to give you the quantities, 26,000 gallons of milk, 27,500 pounds of carrots, 50 tons of fruit, 218,000 boxes of cereal. So this is a major effort, and this is what is going on in these 200 food banks that Claire talked about, and they organize around the country. So the question is, where do people eat? As we thought about this problem, we started to analyze, where do people normally eat? And as Claire's told us, food banks that provide support. Jose has stepped in with restaurants, and we were feeding more than 10% of the U.S. population already. Now, as Claire's projecting, we might be going to 15% of the U.S. population. So where did they eat? If you go to the casinos in Las Vegas, the casinos fed all their employees, generally 2 and sometimes 3 meals a day. If there are 200,000 people working there, you're now talking about 200,000 people ate at work. As you think about restaurants, whether it's 650 or 850,000, how many of those workers, ate in their own restaurant? Whether they were a busboy, a server, a waitress, a cook, they were used to eating at work. And as we step back, and how many meals did hotels that Jose has spoken about that have closed serve a day? And so when you trace, where do people eat? The schools have become a central distribution potential point for people throughout the country, since they were serving meals and had kitchens in most cases. The concept of communities in schools, where you brought doctors and other things onto the campus, particularly in underprivileged areas, presents a very interesting distribution point. If you go to a mall today, and most of the malls are closed in America today, you will find many of them have 20 restaurants, not one restaurant, but 20. And they have parking lots of these regional malls that take 20 or 30,000 cars. And I think what Jose has presented for us is a very interesting option. And that option is that, can we have a double bottom line, a triple bottom line? Can we get people back to work? Can they prepare meals? In the case of our school system, much of the money is coming from what have been school lunches. If I take Los Angeles Unified, the second largest school system in the country, 80% of the children were getting free lunch and often free breakfast at school. So I think Jose has given us a way to look. How do we get these restaurants reopened? What can they serve? And I just cited, one example of these regional malls that tens of thousands of people go to, that have numerous restaurants in them. And can they be used? Obviously, they can be used as food distribution centers, since they have ample parking, ample access to large numbers of people. So if you step back on this system approach and say, okay, where do people go? Where do large number of people congregate? What are convenient places for them to go to disseminate food in food banks? And where do we have kitchens that could prepare food? And the last point that the three of us have participated on is we've spent 30 years studying the microbiome. And we now know that based on what you eat, you can create good bacteria in your body or bad bacteria in your body. And in a period of time when we want people's own immune system to potentially protect them from this virus and other diseases, we need to make sure we're getting quality things. And we understand now when you eat fruits and vegetables what happens, and we understand on the other side when you've dramatically increased the sugar in your food. We, as you know, Ryan, have been pushing this new periodic table that I see is up here today. What are all these fruits and vegetables? Why do they exist? What do they do for you? Can they energize your immune system? And one of the risks here, as people move more and more to staples or things that last longer, is are we taking them away? And when you talk about seeing produce, the produce section of the grocery store is the pharmacy of the 21st century, now that we know this data. And as you know, Ryan, and many others, people are coming into the grocery store and not necessarily buying produce. You have people misleading them today to say, don't buy fresh food because people could have coughed on it, touched it. You could get the virus from this area. But these energize your immune system and can protect you from disease. And so it's extremely important. And when you see that LA Unified in one day is putting out 50 tons of fruits and vegetables, they're trying to deliver not only food, but quality food. On the other side of the coin here, I don't think we've deployed our technology enough. What role do our technology companies play that can allow the farmer and produce to figure out the best way to get to market to a food bank? And so I see this issue. We have two of the most experienced people in dealing with crisis and everyday human crisis, and Claire and Jose, and have responded. And so by using best practices today, using a systematic approach of reopening where food is normally produced for large numbers of people and is convenient to get to, I think we can solve this problem. And as Claire is seeing, a lot of individual philanthropists, many of them are members of the Giving Pledge, have stepped up here to try to support this effort. It's really hard to understand why we should have food insecurity in America, where we have the ability to not only grow food for everyone in America, but for most of the world. And so it is a distribution, organization, and system problem that we need to solve with leadership from Claire and Jose and others that have solved it so many times before.
Thank you, Mike. And let me throw to Claire and to Jose the foundational question: do we have enough food in this country to feed our people?
So yes, we do. We have a significant connection issue between the food and people who need it the most. We absolutely have enough food in this country to feed our people. And if I may talk about a few of the points that Michael just raised. So as an example, when we talk about social determinants of health, which is something I've been really excited to discuss with Mike before, and Jose and I have certainly agreed that there are some big systemic issues that we need to address. These things were hidden in plain sight, right? So we knew that people who are food insecure in this country are 3 times more likely to have diabetes and 2 times more likely to suffer from hypertension. So when we started hearing data that talked about what makes a body system more vulnerable to this virus, I sat in horror to wait for the statistics that would say what I already knew. That people who already are dealing with all of the issues around poverty and all of the issues around food insecurity, that they would be inordinately impacted by the health challenges around this pandemic, while also having to address trying to find food in a scarce environment. Another thing that Michael talked about that I think is worth underscoring: before this pandemic, Feeding America, our network, was the largest food waste recovery organization in the United States. And even with all of our efforts, 72 billion of perfectly edible food were going to landfills every year. So when you talk about technology, and you talk about waste, and you talk about having an apparatus for getting food to people who are facing food insecurity, surely there are ways in this moment to throw out the old playbook and to create a new one. Let's build a future that we want for our country and for all of our neighbors in this country. And I think if there's any good that can come out of this crisis, it could be that we're all now wide awake.
Right.
And that we are going to leverage and we understand our codependencies better than we have in the past. And that as a result of all of that, we then use that energy not only to address short-term solutions, which we have to address some of the short-term solutions, but that we also think about mid and long-term solutions as well. And just in case I don't get a chance to say this or somehow I forget, nonprofit organizations, of course, José's organization, of course, Feeding America, but there are 1.3 million nonprofit organizations in this country. And those organizations are going to be needed even more on the other side of COVID-19 than they were before. So if we can be thinking about how do we ensure that those organizations who are built to serve people in crisis can withstand this pandemic themselves, so that on the other side of it, of the health crisis, they can be prepared to help people who need them even more than they ever did. That's another thing that I just want to make certain that the audience is contemplating.
So Ryan,
I'm glad you raised.
you ask about if it's enough food. I 99.9 agree with everybody that says, yes, we have enough food. We need to be careful. Right now, we have a second plague that is going through Africa. The next plague may be happening in America, and we don't know it. I feel like we don't have people sitting at the White House and the Pentagon, at the national security level, thinking on the worst moment of our planet. We have food until one day we may not have food. Yes, it's true that we are right now in America alone throwing a lot of food. And this is something like with technology, the right approach by government, and hopefully startups, that they will see an opportunity in making sure that food will never be wasted. We can feed everybody. But today, even having experts, NIH, CDC, experts dedicated to make sure that something like what's happening will never happen. We've been caught totally off guard, even when we knew this was coming. Even when Bill Gates said that many years ago that this was coming. Even then for 100 years, we've been saying the next big virus is going to come and it's going to be very bad. We were totally unprepared, having the biggest minds thinking about that problem. I don't think we have good minds thinking about feeding the planet. We have it from the for-profit point of view, but we don't have it from the national security point of view. And me, I'm worried that one day we may be waking up with a very bad surprise. Probably America will, but there'll be other countries around the world that will not. And this is real. And I want to add one thing. We shouldn't be having the lines that we are seeing in food banks across America, in supermarkets. In every place we are, is lines. We are already helping with some markets that we are buying from produce from small farmers that sometimes they don't have the possibility to connect with the bigger food banks. We're buying from them, and in the same place we give hot food. We're once a week also giving them fresh food in some parts across America. But let me tell you how I will solve this very quickly. Let's pay everybody $2, $3, $4 more per hour. Let's make sure that people have enough money, not to be waiting on a line of hunger, but make sure that we give the respect to people so they can afford to go to a market, they can afford to go to a restaurant, and problem solved. What is very amazing to me that some of the bigger companies that donate to the different charities that feed America are sometimes some of the ones that don't pay the biggest salary per hour. Let's be smart. Let's use pay what is right. Let's not throw money at the problem, which is keeping NGOs like mine or Feeding America use running. Why we don't make sure that we go out of business? Why we don't make sure that Feeding America goes out of business? That the small NGOs across America that feed Americans go out of business? This is what we should be doing as a nation. We should be paying the minimum per hour, that people can make a very decent living. And all of a sudden, you don't have those lines that we see all across America. Not now, in any moment in our history. This is something I hope we will learn for the future.
Yep. And I should add, I've been very impressed by the way that you at World Central Kitchen and Feeding America and a whole list of nonprofits doing amazing work in this space have coordinated yourselves quite quickly. And I know we have some tremendous donors to thank for some of that. And the philanthropic response in this country has been truly outstanding, with people like Laureen Powell Jobs and Leonardo DiCaprio creating America's Food Fund, and Jeff Bezos and his $100 million donation. And it's been really heartwarming to see this money coming in. And I know it has been a forcing function and some coordination among nonprofits. But what I'm hearing you say, Jose, is that we need cooperation and collaboration, not just among the nonprofit community, but across the food system. And I think I'm hearing you, Mike, say too, we need a systems approach. So where is that coordination, that coordinating entity? Where is the food czar that can help us make sure that all of the pieces of our food system are working together? Mike,
Ryan, we live in a free enterprise system, have economic freedom, and I think Jose has spent plenty of time talking about strengthening that system. And so the sessions that Claire or Jose and I have been on over the years have focused on a dramatic change in the food chain. In 2007, the Milken Institute published An Unhealthy America, and it focused on the dramatic change in weight in America over a 25-year period of time. And just the change in weight in America cost the United States $1.5 trillion a year. And that was only for 7 chronic diseases. And one of the largest costs was depression and understanding what that meant. And what Claire pointed out, and I just want to emphasize, is those with high blood pressure, those with diabetes, are much more susceptible to having far more adverse reaction to the coronavirus. And so this is the cycle that Claire spoke about. We're eating the wrong foods. We've become very heavy. We got diabetes. We have high blood pressure. And now this crisis hits. And so what Claire has asked is, can we learn something from this crisis to change the food system? The marketplace, as you know better than anyone, Ryan, had already done that. Whether it was Beyond Meat going public or Impossible Foods or thousands of new food tech companies growing up, because science today allows us to tell you what happens to your body when you eat something that you could never have before. And we have found a way to reduce the severity of diseases by just changing your immune system. And in fact, in some cases, able to put cancer into remission by having good bacteria and strengthen your immune system. So Claire and Jose, as I see it, are asking for 2 things. One, case of Claire, can we use this tragedy, as we're going to feed 15% of the population who is most probably at risk or has diabetes or hypertension and at risk for this disease, to try to find a way to get more things into their body that would be healthy and maybe change their physical condition because of it. Jose has said, in a free enterprise economic system that has created more jobs and opportunities for anyone in the history of the world, can we find a way that that system is working effectively, paying our workers enough so they can go to the grocery store, opening up these small and medium businesses again for feeding and getting that system going? The people that prepared food in this country, we're talking 8 to 10 million people, far more people than work in growing food. But once again, in fruits, vegetables, and other things, we've been the breadbasket for the world. And we need to figure out how to get it from our ability to grow into people that need it. And at the same time, while they're not working or businesses are closed, we might be able to provide some knowledge and education. We know historically that people don't want to be lectured. First Lady Michelle Obama, when she tried to tell you to move and to do this, she was extremely popular, maybe the most popular woman in the United States, but even she could not have a major effect on what people were eating, et cetera. And I think we've had two calls to action that I think are extremely important by Claire and Jose here. One, can we change what people are eating and they have an understanding of nutrition, et cetera, and get them quality food? And number two, can we shore up our free enterprise system of millions of entrepreneurs and their small businesses at the same time?
Yeah, Michael, to at least one of the points that you were making, we have had some wonderful success before COVID-19 around things that, again, you talked about people not wanting to be lectured to, but you can use science and availability to help people to make great choices for themselves. I'm not a proponent of me making choices for people. I don't make all the best choices for myself, but I am a strong proponent of providing people with great nutritious options and creating an environment in which making that choice is something that they understand fully and that they get to do. And we have data inside of the work that we've done that has shown when you do that people make great choices. So nudging, how you place fresh fruit and vegetables when you have a market design where people come in and get their food and their produce, abundance is key to it as well. So I know Ryan and I had a conversation about a recent announcement from the USDA, and I think that announcement is emblematic of the opportunity that we have right now. So people have seen in the press produce, and we talked about it earlier in the lead-in to this conversation about produce that's being wasted, about milk that's being wasted. Well, the Secretary Perdue just recently announced last week on Friday a new initiative that we're going to undertake together. And when I say we, I mean public, private, and nonprofit, all at the table together, and contemplating how do we get that fresh produce and milk and lean protein, how do we get it from where it is to where it really needs to be today? And we're trying to create a new model for distribution of that very thing. So they're early days, but it's really, really promising work, and I'm excited to participate in that work, and I'm really glad that Feeding America has a seat at the table. But we're making room at that table for other nonprofits as well, because we understand one of the things we certainly do not have a lack of in this country is brilliance, innovation, ingenuity, stick-to-itiveness. All of those things are required in this movement, and if we leverage all of that together, we're going to be better on the other side of this tragedy than we were on the reverse before the whole tragedy began. I have an expression that I sometimes use, Ryan, which is, and my pain needs to pay, right? This is a very painful moment, but it's also an opportunity for us to come out of it better. And my biggest concern is that we will focus on the near term and that we will come up with some effective, much more effective ways of matching food with people who need it in the near term. And we certainly need to do that. My concern is that we won't use the moment to think about longer term issues and challenges.
Right.
We won't build an infrastructure that's sustainable, even in the midterm, because the cameras will go away.
We've had several questions around how we use this moment to come out stronger. What are we learning? And Jose, I can tell you want to jump in. You want to get your perspective on this.
I mean, I am not as optimistic as Claire. Even believe me, Claire and I, we've been talking quite a lot. I've been learning a ton from her because she's a true leader, and we're so lucky that she's leading Feeding America in this moment. But I'm not, for a simple reason. I do believe the people, the men and women of the government, are great people. They do their best. But when I know that in emergencies, FEMA is the one supposed to be feeding Americans, and I see what they do sometimes in some states. I don't have a lot of hope. USDA is great men and women, and I do believe that even Secretary Perdue, they have the good intentions, but they have so much red tape that the ideas may be up here, Congress may approve the money, billions of dollars, but then the money is there, and it's not enough creativity in government to make it happen. We don't need new systems. They've been going on for centuries, thousands of years. Every community will have a market, and that market will thrive. And the farmers will come to the market, and they will sell what they have. What we're talking here is that these people that maybe cannot afford to buy in this market, we should be having in every food desert neighborhood in America a USDA government investment market to make sure that people go to the market in the same way I do with my daughters. I have a feeling that people don't want our pity, and sometimes I feel we give them that. People want our respect. And we love, like in Anacostia, we will have a market that will be daily, where twice a week, fresh foods will come in, and the farmers will arrive, and we will be helping them through snaps, through food they will buy on their own, etc., bringing fresh fruits and vegetables to every community of America. If this has not happened in the good times, I have a hard time believing it's going to happen in the bad times. Even I'm hopeful, like Claire, that maybe now is the moment for her and I and others to push the government to start bringing all of these things forward. Snaps. We have the systems. You know what happened in Puerto Rico? The electricity went out. Was no computers, was no satellites, was no cell signal, because the SNAP, the cards in Puerto Rico, they were digital. They used the electricity. Nobody could use it. I was begging to everybody I could talk to in Washington if they could go paper for a few weeks. Mm-hmm. They didn't do it. Why? In an emergency, we need adaptation. In an emergency, we need the urgency of yesterday. And this is, to me, an emergency right now, that the main problem is this. If we don't hear our president, we don't hear government saying that this is a humanitarian crisis, it's like nothing is happening. I need to hear our leaders to say, this is a humanitarian crisis right now. Because in the moment we bring those words forward, doesn't imply that anybody is doing anything wrong, but you recognize that you have a problem, and then you put everybody, government, private sector, NGOs, big and small, to work together to solve that problem. Until I don't hear from our bigger leaders that we have a humanitarian crisis happening right now in America, I don't believe we will take the issue at hand seriously enough. And just to end, there's one word we need to be talking, Mike, distribution. Everything about life is distribution. If you want to have good education, it's distribution of knowledge from the teacher to our children. If it's about beauty, it's the painters distributing through museums the paintings. Anything in life is about distribution, passing something from one point to another. When it's about hunger, it's making sure that until we don't fix the distribution problems we face, food will be wasted as people will be hungry. If we are able to solve that very simple formula of distribution, where people have a lot, we need to pass it to where people don't have a lot. In this country, we should be able to achieve that very simple goal with technology, with empathy, with good bills and good policy, with good for-profits and non-profits, and together make sure that we do the right distribution of the goodness of the earth, so nobody in America will be hungry.
Hey, Ryan, I know that there are some questions that you want to get to. I just want to share just something, if I may, very quickly. I think there's a difference between cockeyed optimism and clear-eyed optimism. I am not a cockeyed optimist. I know that we have the ability to use this moment to be better on the other side. There's no good reason why we won't, except if we decide not to, and that's not a good reason why not to. So I've trusted that people will find ways to do the right thing. I've benefited from people doing it. And I'm confident that if it ever were going to happen, this is the moment that it will. And the fact that you would convene that many people who are participating with these questions that I'm seeing pop up around, so what do we do to make it more sustainable? I do believe we have the critical mass of people who have the level of awareness necessary and the wherewithal to come together during this moment and to do something magical that we haven't done together for a very long time. So I am a clear-eyed optimist, not a cockeyed one, Jose.
No, I know you are. And having you next to me helps me my optimism, believe me.
Ryan, just a couple things till we open up. First, entrepreneurism is alive and well. In terms of dealing with the medical challenges today, there is not one pharmaceutical, biotech, healthcare company in the world that isn't trying right now to look through their libraries to solve the medical issue to address. This issue we've raised today, you're going to find the solutions from entrepreneurs. They constantly occur here. Distribution. Who is hiring the most people in America? Who are the two largest employers in America? Walmart and Amazon today. Kroger, hiring thousands of people today. And we underestimate the fact that the United States is the most charitable country in the world. And one of the great strengths of the United States is its social capital, people helping others. Technology today, we're seeing young people go to the grocery store, go to the pharmacy, and pick up for their neighbor, a senior citizen, and bring home. All that has to do is companies like Airbnb or Lyft, all of these companies, or Uber, what they've created is ability for people, and whether they're getting paid or they want to give of their services, this technology exists so that there will be no food deserts in America because of distribution capabilities that exist today. And so what we need to do is a call to action, just like we've had a call to action to all the pharma and biotech companies to go through their libraries to find out how to stop this virus or how to stop immunology. We need a call to action to many of our technology companies today and ask them, please help us right now in food distribution, what we can do just in time and absorb millions of people that might want to volunteer to help to get things from point A to point B. This is the solution that will occur. That's why we have crowdsourcing, getting the best ideas from anybody in the world, filtering those ideas, and then putting them into action. And so I am confident that we will solve this problem. And I do believe that one of the benefits that will come out of this human tragedy of enormous proportions will be eliminating food deserts and distribution. How do we get strawberries to everybody? How do we get green beans to everybody? And also a solution that our restaurants could reopen to be part of the solution and employ people and give them a mission by getting back to work. So we might have to, Ryan, put out a crowdsourcing for our best ideas here on how to do this. But I would count more on the entrepreneurism and creativity of individuals in America than deciding that government is going to tell us on what to do and have the best answers.
So, Mike, let's do that. Let's put out, I'm hearing Jose in particular talk about the urgency of now. And let's put out this call to action. I want to acknowledge the questions that are coming in. You as panelists are hitting them on the head, and I'm not needing to ask them. We're having a lot of questions around how do we come out of this stronger and not weaker? How do we ensure that we're getting nutritious foods that optimize health and immunity at a time like this to all people? And you're answering these, and I want to acknowledge the questions coming in. But you made a really important point, Mike. What is, Jose and Claire, I'd like to give you the floor to present this call to action. Who do we need to step up? What's your call to action to the entrepreneurs? Who's in the distribution and repackaging? I know is an issue field that we need to come to the table. Let's hear from you. Claire, you want to go first?
Sure. So in the here and now, right now, because of the challenges that we're having around safety and the fact that an inordinate number of our volunteers are in fact themselves vulnerable because more than 50% of our 2 million volunteers in normal times are seniors and have other challenges, underlying challenges that make them more vulnerable. One of the things that we absolutely need is volunteerism. So we need people who are willing to sign up to help on the ground. And I'm thinking about volunteerism in a more comprehensive way, though. So certainly we need people to help distributing food, but we also need that brain trust that Michael is so confident about. We need entrepreneurism and volunteerism in terms of the big ideas around how to solve some of the short-term, midterm, and long-term implications of what's happening now. We need food right now. So we need shelf-stable food that we can distribute quickly. So that's another area. But then when we start thinking about and pivoting more toward mid and long term, one of the equipment needs that we have is refrigeration. We need refrigeration right now in terms of when we get produce in, of those 60,000 pantries and soup kitchens, so many of them don't have adequate refrigeration so that they can't even store healthier foods. So it help with people donating for a period of time, short-term donations of that refrigeration space. So to the extent you have people listening in who can help in that regard, that would be powerful and helpful to us. But then longer term and midterm, we need people who are willing to invest with us in that refrigeration inside of those pantries so that when the cameras are gone, they're still able to actually take in more of that produce and healthier food so that they can get it out into their communities as well. Something that Jose hinted at that I think is important is that also short, mid, and long term, that we not forget the people who are most vulnerable at this moment. They're going to continue to be really vulnerable beyond COVID-19 as well. So what about on the policy front? Do any of us listening or participating think that the ideal should be, in order for people to feed their families, that they need to go to a food pantry and get food in order to be able to feed themselves and their families? Or that they have to go and pick up a box lunch, as good as it might taste, from World Food Kitchen and bring it back and eat one and then bring it home to be able to feed their families. I think we ought to be looking comprehensively at how we make this country work for everyone better, right? And how do we contemplate mid and long-term strategies that are going to address some of those systemic issues that have given rise to this inordinate impact on particular communities versus other communities. So we need people right there with us thinking about the long-term policy and short-term policy. I heard Jose talk about SNAP. One of the areas that's a lot more efficient for feeding people who are food insecure would be for them to be able to go to a grocery store themselves and use an EBT card to be able to purchase things for their families. We're strongly in favor of having that be one of the things that we add to the playbook in the here and now for families who are food insecure, so that you don't have all of those people going to one distribution trying to get food all at one time. So I know that's a lot that I'm saying there, but I think hopefully some of those were cogent thoughts that people who are listening in might be able to filter their way through. I think anything but short, mid, and long term.
Thank you.
Brian, I'd just like to give 15-second answers to what Claire's challenge. Number one, let's go to where the freezers are, not try to bring freezers. So you have hotels closed that might be serving 10, 20, 30, 40,000 meals a day. They all have freezers in them. No one's staying in the hotels, and they're not feeding. So let's move the food banks to the parking lots of hotels and use their facilities. Let's bring their workers back into the hotel, into the kitchen, so that they can work to make the meals. The next thing that Claire raised here, let's just use data. if we're going to give people credits to go buy food in a grocery store, let's price those credits so that they get 50% off vegetables and fruit, and other things cost more. So we can use technology today to adjust the pricing to people that are using what we could call digital food stamps if we wanted to. And so you could alter what the price is on the store just by trying to alter what they're buying.
And Jose, I know we're running out of time.
Yeah. So, I think number one, what we need is, I said it before, we need our leaders to recognize we have a humanitarian crisis right now. And or they are not walking the same streets I'm walking every day, or I don't know what's going on. Until we don't get them recognizing this is a humanitarian crisis, we're not going to have them passing the right bills to make sure that America is fed. Feeding America shouldn't be having a problem with budget. Every single food bank in America should have enough money right now to be able to buy from small farmers and perishables, non-perishables, to make sure that they're able to cover their short-term needs. I will say that shouldn't even be volunteers. As the number of unemployed has grown, I think the federal government should be investing money in Feeding America and others, and pay people. So in the process, we put money into the economy. Volunteers are good in other moments. Now, let's pay people to do the work that needs to be done. Let's make sure that we increase SNAPs, but that the money should be going to fresh vegetables. And let's make sure that people also can be buying in any market, and that they can be buying hot food in restaurants. All of a sudden, SNAPs, the billions of dollars that go into SNAPs, they're put in a smart way to feed America. We need to invest more money. USDA should be buying from small farmers. They are about to go bankrupt if USDA really doesn't go. We're putting a lot of money on subsidies. We need to put much more money in buying and supporting small farmers, and find ways to put that food through food banks, through NGOs like mine, through other sources, so the small farmers of America can be part of the solution and they become richer in a moment of this repair. I'm very afraid rural America will become poorer if we don't really invest into the right solutions. The government, in partnership with Feeding America, partnership with NGOs like ours, all across the country, we should be opening markets in the food deserts. Why we didn't do that? That will be another amazing way to provide food relief for the long term in forgotten communities across America. We need to have those farmers markets we need to increase wages, as I said. If we increase wages, half of the problem we face goes away. Why we don't increase wages? Why we have companies that they are delivering great dividends at the end of the year, very much underpaying their employees, and those same employees are the ones that have to be going to charities. You know what my friend Robert Eggers said? That charity seems is always about the redemption of the giver, when charity should be about the liberation of the receiver. Any idea we put forward should not make us feel good and claim, well, because you are a politician or NGO or a good donor, hey, look at, I'm doing the good thing. No, we need to be looking, are we liberating the receiver? We need to be bringing high tech. World Central Kitchen, we're using Uber and Lyft to distribute to elderly homes all across America. Restaurants to hire. FEMA should be hiring those restaurants in every community that there is need. We put the restaurants at work. We make good use of the FEMA money. All of a sudden, you have hundreds of thousands of restaurants feeding their communities. World Central Kitchen, we already have more than 500 restaurants, and we are adding restaurants every single day. And we pay anywhere between $8 and $10 per meal, so they can take care of their employees, their farmers, and at the same time, they can make a little profit to pay rent and feed the people. And used to end. We need to be thinking out of the box. I know Mike has been said, the hotels, it's an idea I like. I used it before in many parts of the world. This is a major one. We're using arenas right now. I believe the schools should not only be used to feed the children. I think the school lunches of America should be increased by Congress and through the USDA to also feed those families in the very poor neighborhoods. So don't waste one trip to the school to feed one children. Use that trip to the school to feed the entire family, etc., etc. And also don't normally give them, you can give them perishables, but you can be giving them a good hot food, plate of food. At the end of the day, as you see, and things I'm forgetting, the idea that one single unit can be feeding America is not possible. It requires a lot of different organizations to make it happen. So we reach every single corner. I believe the government, the Pentagon, FEMA, we need an organization that is dedicated to feed America. I don't think it should be inside FEMA. I don't think even should be inside USDA. I do believe right now we need a FEMA of food for disasters and for peace times. If we're able to put the problem of food away, we create opportunities for everybody involved. So the final idea is let's create a FEMA of food. And then many of the problems will go away because everybody will work better together. We will be able to support each other, and all of a sudden, food is not the problem, but food is the opportunity for a better tomorrow.
I want to, we could continue this conversation. I'm getting all sorts of notes here that we have to wrap it up, and everybody's got to get back to work. And I want to say just a typical thank you I would typically give at the end of a panel, but like, honestly, I wish I could grab you each by the shoulders and look you in the eyes and say, on behalf of a grateful nation, I shudder to think where we would be without the work you've done already and all the work that you're going to be doing to get us through this and through a recovery.
Thank you all.
That's great. I love it.